Fort Pierce, Florida. It is the evening of the 21st of February. I am Connor Christopher, and today we are bringing you the latest information in applied psychology. Today's debate revolves around a more serious topic, so listener discretion is advised. The prevalence of mental health illness has increased drastically at the turn of the century, and one particular condition has more severe social implications than the others. Despite its classification as a mental disorder, empathy seems to run short for those suffering from substance use disorder, which is defined by the APA as a complex condition in which there is uncontrolled use of a substance despite having consequences. People around the world have been debating this question: is substance use disorder a moral dilemma or a medical condition? Here we have expert Cindy Hernandez, who has analyzed multiple studies on this topic. Now, Cindy, can you tell us a little bit more about the stigmatization that is associated with substance use disorder?
Thanks for having me, Connor. Throughout this segment, I will be referencing a study published by Cult Med Psychiatry, Henderson and Associates, authors of a well-researched 2017 medical disease or moral defect, used a sample population of college students ages 18 to 25. The study shows that an estimated 20% of college students in the U.S. meet the criteria for substance use disorder. Of those 20%, only 3.9% will receive treatment.
That sounds discouraging. You can only imagine the numbers must have gone up over time.
Perhaps so, but these numbers bring about a different question. Why is there hesitancy to seek help for substance use disorder? Henderson's study shows that individuals with this disorder are more likely to perceive negatively than individuals with other behavioral and emotional disorders. The reality is why cultural consensus analysis, abbreviated as CCA, was developed. The CCA was an analytical module crafted by Henderson and Associates that recognizes patterns of disagreement and attempts to understand cultural models.
Can you tell us a bit more about the groups established by Henderson and his co-authors?
Absolutely. 39 college students participated in face-to-face interviews and provided potential causes of addiction. All the responses collected were then divided into groups by another sample of students. The responses fell into one of 5 groups, apart from one item. These groups include biological, self-medication, familial, social, and hedonistic. The biological group presents addiction as a genetic and physical matter, while the self-medicinal group presents it as a way to cope with physical or emotional pain. The familial group presents it as an effect of family life and environment, while the social group presents it as an effect of the individual's social life. Lastly, the hedonistic group presents it as a result of sheer boredom and curiosity.
And all the participants fell into one of these groups?
Well, all but one did. Willpower was a cause that could not cluster into any of the other groups. Besides that, the 5 distinctive themes were further grouped into a multi-centric domain, medical and moral. The medical domain included the biological and self-medicinal groupings, while the moral domain included the social and hedonistic groups.
We would make a wild guess that the stigmatization was mostly occurring in the moral domain, wasn't it?
Exactly. According to Henderson and Associates, people will adhere to the moral domain and will most likely stigmatize individuals with substance use disorder.
To further dive into this topic of stigma, what could have caused college students to feel this way about substance use?
That's an excellent question, and research shows that drug education in the U.S. might contribute to the stigma whether or not it is purposeful.
So that includes campaigns like DARE and Just Say No, right?
Precisely, but this also extends just past college students. I would like to reference another article published by the Journal of Substance Abuse Treatment, Beilenberg and Associates, authors of 2021 paper, A Systematic Review of Stigma Interventions, concluded that providing education for healthcare professionals can reduce the stigma against individuals with substance use disorder.
Even health professionals have negative attitudes towards substance users, though, don't they?
Unfortunately, it is not uncommon. By synthesizing the studies presented by Henderson and Beilenberg, you could conclude that there is a correlation between stigmatizing behaviors and drug addiction. This type of education dictates if this correlation is positive or negative.
Meaning that programs like DARE might correlate to negative stigmatizing behaviors, while education for health professionals might correlate with just the opposite?
Correct, but it is a little early to decide if there is a cause and effect relationship between the 2 variables.
I understand. Going back to the article published by Beilenberg, or published by the Journal of Substance Abuse Treatment, you mentioned that Beilenberg and her co-authors noted a positive change in healthcare professionals after undergoing special education. Can you tell us a bit more about that?
Absolutely. To provide more context, the review provided by Beilenberg and Associates gathered the results of 15 studies from a multitude of countries like Kenya, China, Sweden, and the U.S. Self-reviewed questionnaires tracked whether or not medical professionals considered substance use disorder worthy of medical resources. 185 nurses participated and completed the study, with the majority of participants being females aged 26 to 45. In 2 of the 15 studies, 6 months of online interventions, 8-minute online modules, and viewing videos of substance use sufferers resulted in a much more positive attitude towards patients with substance abuse problems.
What about the other studies referenced, though?
They also showed that increased education of the lives of individuals with substance use disorder resulted in not only more positive attitude, but also improved patient outcomes. Before the interventions, the sample medical professionals were more likely to note things like argumentative, aggressive, or manipulative on the charts of people with substance problems.
So these studies suggest that stigma towards individuals with substance use disorder might be based on lack of understanding and education rather than malicious intent.
There definitely seems to be a correlation between improper education and stigma attribution. It is unfortunate, but these studies show that there is a way to move forward as a collective and improve the lives of those suffering with addiction.
We can only hope that this research becomes more public and widespread so we can find a way to make those facing this condition feel less discriminated against. We appreciate you being here and informing the community on stigma attribution. Thank you for participating in the segment.
I'm glad to spread the message. Thanks for having me.
You heard it here first. While the voices of the professionals are here particularly important, we'd also like to hear from members of the community. Let's see what our ground reporters were able to find.
Hi, I'm Hannah. I'm here with Victoria on the IRC campus, and I'd like to ask you a few questions. Do you think individuals with substance use disorder are more likely to be discriminated against?
Yes, I do think that because there's a lot of stigma around it and they can be seen as unreliable.
And would you be comfortable employing or befriending someone with substance use disorder?
I would be comfortable befriending someone with substance abuse disorder, but I don't think employing somebody with substance use disorder.
I'm here with John on the IRC campus, and I would like to ask you a few questions. Do you believe substance use disorder is a moral dilemma or a medical problem, and why?
Well, honestly, I feel like it's probably a bit of both, and it depends on the person. Some people just have problems with regulating themselves, and once they get a hold of something that's hard, I guess, that is hard to get to shake, then they'll be stuck with it. And then there are people who get into it who probably who could have said no or avoided it altogether and get stuck with it because of their choices.
And what could our community do better to accommodate and understand these individuals with substance use disorder?
That I'm not entirely sure. Well, I suppose one thing is to would be to recognize it in people early on. Well, help them to avoid situations where they might encounter that. Obviously, sometimes people get hooked on medical drugs because of medical situations. So I would say help them regulate even from the start, so that they don't get stuck on it. Just I guess try to identify it in people and try to help them to stay away from things like that. I don't know.
Thank you for your time. I'm here with Emily on the IRSC campus, and I would like to ask you a few questions. 20% of college students in the U.S. meet the criteria for substance use disorder. How does this make you feel about the future of today's youth?
I guess it makes you feel a little bit pessimistic about what the future is, but hopefully there is help out there that's available.
And was there ever a time where you believed misconceptions about individuals with substance use disorder, and why?
Yes, it's very easy to have misconceptions, especially since most of the time we have we normally have misconceptions because of how media portrays things.
Thank you.
Thank you, Hannah. From this ground report, while it seems that People affirm some of the stigmas around substance use disorders and feel pessimistic about the future of those who suffer from it. They also sympathize with the plight of the people who face this disorder, though most tend to avoid this topic due to its rather sensitive nature. That is all we have for this segment. Perhaps you have changed your opinion after hearing all of this, or perhaps you've at least learned something new. I'm Connor Christopher with CCN. Thank you for tuning in.